chocolate and sweets. The overwhelming urge for candy, chocolate, cookies, and sugary foods can strike at any hour during pregnancy. You might find yourself craving dessert after every meal, sneaking candy bars between appointments, or fantasizing about specific chocolate brands with an intensity that feels almost irrational. This powerful pull towards sweetness is driven by dopamine-seeking behavior as pregnancy hormones fundamentally alter your brain's reward pathways, combined with rapid blood sugar fluctuations resulting from increased insulin resistance that develops as your body adapts to pregnancy. Your body is signaling its need for quick energy and mood regulation as it works over time to support fetal development, though these cravings rarely indicate true glucose deficiency or nutritional emergency. Moderate indulgence in sweets is perfectly safe and can provide genuine psychological comfort during a physically demanding time. But excessive consumption increases your risk of gestational diabetes and contributes to unnecessary weight gain that complicates delivery and recovery. Sweet cravings reflect neurological adaptation to the profound hormonal shifts of pregnancy, not character weakness, lack of discipline, or moral failing on your part. Ice and frozen items, the compulsive need to chew ice cubes, frozen fruit, or extremely cold beverages represents one of pregnancy's most distinctive and medically significant cravings. Some women consume pounds of ice daily, crunching through tray after tray, keeping cups of ice constantly available, or seeking out specific ice textures from particular machines or restaurants. This specific craving, called pagophagia in medical terminology, is strongly correlated with iron deficiency anemia, though researchers still debate the exact mechanism connecting ice consumption to low iron levels in the bloodstream. The prevailing theory suggests your body may be seeking the alertness boost and mild stimulation that ice chewing provides when profound fatigue from anemia sets in, essentially using ice as a crude stimulant to compensate for oxygen-depleted blood. This craving requires immediate medical attention and comprehensive iron level testing through blood work, as it frequently indicates potentially severe deficiency that affects both fetal brain development and your own cardiovascular function during the immense demands of pregnancy. Ice craving is not about temperature preference, comfort, or quirky pregnancy behavior, but a red flag for anemia requiring immediate medical intervention and supplementation. Salty foods, chips and pickles. Intense desire for potato chips, pickles, olives, salted nuts, pretzels, and other high-sodium foods often emerges during pregnancy, sometimes combined in unusual quantities or eaten straight from the jar. You might finish an entire bag of chips in one sitting, drink pickle juice directly, or add salt to already seasoned foods with abandon. This salt obsession is triggered by your dramatically expanded blood volume, which requires significantly increased sodium to maintain proper fluid balance throughout your circulatory system, plus altered taste perception that makes salt more appealing and less overwhelming than it was before pregnancy. Your body is correctly signaling a genuine physiological need for additional sodium to support the 50% increase in blood volume necessary to nourish both you and your developing baby through 9 months of growth. Moderate salt intake is not only safe, but actually necessary and beneficial during pregnancy, helping maintain blood pressure and preventing dangerous electrolyte imbalances, though excessive consumption can exacerbate swelling in your extremities and contribute to blood pressure issues in susceptible women. Salt cravings during pregnancy represent legitimate physiological need backed by cardiovascular demands, not unhealthy behavior that should be suppressed or a dietary mistake requiring guilt. Citrus fruits. Craving for oranges, grapefruits, lemons, limes, and other acidic fruits can become intense during pregnancy. You might eat whole oranges throughout the day, drink glass after glass of grapefruit juice, or even consume straight lemon juice in quantities that would have seemed unbearable before pregnancy. This citrus obsession is driven by dramatically increased vitamin C requirements for collagen formation in fetal tissue development and enhanced iron absorption from other foods. Plus, citrus's remarkable ability to combat nausea through both scent and acidity that stimulates digestive processes. Your body is seeking both specific nutrients critical for building a healthy baby and natural relief from morning sickness through the acids that jumpstart sluggish digestion caused by progesterone. Citrus consumption is highly beneficial during pregnancy with minimal health risks beyond potential dental enamel erosion from excessive acid exposure if you consume citrus constantly without rinsing your mouth. Citrus cravings combine nutritional wisdom with sophisticated self-medication against pregnancy symptoms. Red meat. Powerful urge for beef, lamb, burgers, and steaks, particularly rare or medium-rare preparations, often emerges during pregnancy, sometimes intensely among women who previously ate little meat or followed plant-based diets. You might find yourself fantasizing about juicy burgers, craving the specific taste and texture of rare steak, or feeling drawn to red meat in ways that surprise you given your pre-pregnancy preferences. This craving is caused by dramatically increased iron demands created by expanded maternal blood supply and intensive fetal development, plus your body's need for high-quality complete protein and B vitamins that are concentrated in red meat at levels difficult to obtain from other sources. Your body is signaling critical need for heme iron, the form found in animal products that your digestive system absorbs far more efficiently than the non-heme iron available from plant-based sources like spinach or beans. Red meat consumption is genuinely beneficial during pregnancy, when meat's properly cooked to safe internal temperatures that eliminate risk of foodborne illness from bacteria or parasites. Red meat cravings represent sophisticated nutritional signaling for the bioavailable iron and complete protein your body recognizes as essential. Dairy products. Craving milk, cheese, yogurt, ice cream, and cottage cheese in significantly larger quantities than your pre-pregnancy consumption is extraordinarily common. You might drink multiple glasses of milk daily, eat cheese with every meal, or consume entire containers of yogurt in single sittings. This dairy obsession is driven by increased calcium requirements for fetal skeletal development throughout pregnancy and the critical need to maintain your own bone density while your body pulls calcium to build your baby's forming skeleton. Plus additional requirements for vitamin D and high-quality protein. Your body is requesting calcium to construct your baby's bones and teeth without depleting your own mineral reserves in ways that could cause long-term osteoporosis or dental problems years after pregnancy ends. Dairy consumption is highly beneficial during pregnancy unless lactose intolerance develops or worsens, a change that occurs in some women during pregnancy and requires obtaining calcium from fortified alternatives or supplements. Dairy cravings serve the dual purpose of protecting fetal skeletal development while simultaneously safeguarding maternal bone health. Carbohydrates, bread, and pasta. Intense desire for bread, pasta, rice, bagels, and other starchy foods emerges powerfully during pregnancy. You might want these foods plain, without elaborate sauces or toppings, craving simple bread or pasta in quantities much larger than your typical portions. This carbohydrate obsession is triggered by your increased metabolic rate and your body's need for quick, efficient energy as your system works continuously to support fetal growth, plus carbohydrates' essential role in serotonin production that directly affects mood stability during hormonal turbulence. Your body is seeking efficient fuel to power the dramatically increased energy demands of pregnancy and neurochemical balance through serotonin pathways during the most intense hormonal fluctuations of your life. Complex carbohydrates from whole grains are genuinely beneficial and should be consumed liberally, while refined carbohydrates from white bread and regular pasta require moderation to prevent excessive blood sugar spikes that contribute to gestational diabetes risk. Carbohydrate cravings reflect legitimate energy demands and mood regulation needs, not simple comfort seeking or emotional eating. Spicy foods. Craving hot sauce, jalapenos, curry, wasabi, and intensely spiced dishes can develop during pregnancy, sometimes with dramatically increased tolerance for heat levels that would have been overwhelming before. You might douse every meal in hot sauce, seek out the spiciest menu options, or find yourself adding cayenne pepper to foods that never needed it before. This spice obsession is caused by the endorphin release that spicy foods trigger in your brain, providing natural pain relief and mood elevation during a physically uncomfortable time, plus metabolic and hormonal changes that alter taste perception and increase your tolerance for intense flavors. Your body is seeking endorphin-based mood management and powerful sensory stimulation as taste sensitivity fluctuates wildly throughout pregnancy. Spicy food consumption is perfectly safe during pregnancy unless it causes severe heartburn or digestive distress, both of which increase in frequency and intensity during pregnancy due to hormonal effects on your digestive tract. Spicy cravings represent self-medication through your body's own endorphin systems, sour foods and lemons. Desire for extreme sourness, including straight lemon juice, sour candy, vinegar-based foods, pickled vegetables, and fermented items, can become intense during pregnancy. You might drink lemon juice directly, eat sour candy constantly, or crave foods with vinegar-based dressings and marinades. This sour obsession is driven by digestive enzyme stimulation that sour tastes provide, and helping combat nausea and sluggish digestion caused by progesterone's relaxing effect on smooth muscle throughout your gastrointestinal system. Your body is strategically using acidity to jumpstart digestive processes that pregnancy hormones have significantly slowed, essentially self-medicating against common pregnancy digestive complaints through taste-triggered enzyme release. Sour foods are beneficial for nausea relief and digestive stimulation, but require attention to dental care, as the acids in these foods can erode tooth enamel with repeated exposure throughout pregnancy. Sour cravings demonstrate your body's strategic deployment of taste to regulate digestive function compromised by hormonal changes. Pica, non-food items. Compulsive urge to consume dirt, clay, chalk, laundry starch, soap, or other non-nutritive substances represents the most medically concerning pregnancy craving. You might feel driven to eat these items despite knowing they are not food, experiencing powerful urges that feel similar to hunger, but directed towards substances your rational mind recognizes as inedible. This dangerous craving is caused by severe mineral deficiencies, particularly iron and zinc, though the exact mechanism remains partially understood by researchers studying the phenomenon. Your body is signaling critical nutritional depletion, requiring immediate medical intervention, as pica substances may contain trace minerals your body desperately needs, or may simply result from profoundly disrupted mineral sensing mechanisms in your brain. Consuming non-food items is dangerous and potentially life-threatening, risking toxin exposure from contaminated substances, intestinal blockage from indigestible materials, and parasitic infection from dirt or clay. Pica is never normal pregnancy craving, but always a medical emergency indicating severe deficiency, requiring immediate treatment with high-dose supplementation and medical monitoring. Bizarre food combinations. Craving unexpected pairings like pickles with ice cream, chips dipped in chocolate, peanut butter with sardines, or French fries with milkshakes emerges as one of pregnancy's most culturally recognized phenomena. You might combine foods you would never have considered mixing before, finding these strange pairings not just tolerable but genuinely delicious and satisfying in ways that surprise you. This combination craving is driven by complex simultaneous nutritional signals, creating desire for multiple nutrients at once, your body efficiently requesting protein, fat, carbohydrates, and specific minerals through a combination approach, plus altered taste perception that makes unusual flavor pairings appealing where they once would have seemed repulsive. Your body is efficiently requesting multiple nutrients through strategic combination rather than experiencing sequential cravings that would require eating many separate foods throughout the day. These combinations are harmless and even beneficial unless individual components pose specific risks like raw fish or unpasteurized cheese. Combination cravings reveal sophisticated multi-nutrient signaling and biological efficiency. Not random pregnancy weirdness, but your body's practical solution to complex nutritional needs.